I'm going to talk to you about postoperative pain control. Even in the best surgery, there's going to be some pain after surgery. We'll cover ways to control that pain, such as medications, positioning, relaxation techniques, and some supportive medications. Let's talk about these strong narcotic pain medications now. Your doctor is going to consider all of your allergies, your home medications, and your medical problems before he or she assigns a specific narcotic to you. In your first 3 to 4 days after surgery, you want to stay on top of the pain. So take those medications pretty much on a schedule. You want to make sure you take them before you go to physical therapy, before you leave the house, and before you go to bed, if possible. That way you'll sleep better, you'll have a better physical therapy session as your therapist can push you further without putting you in undue pain. And it's important to know when you take these, they're not going to cut your pain down to zero. You still will have some pain. Patients and their family members frequently ask us if they will become addicted to their pain medications. The answer to that is it's highly unlikely. You're only going to take them for 4 to 6 weeks before we have you taper completely off of them. I'm going to talk to you about some medications that we give you during and after the time frame you're taking the narcotics that also help control your pain. For example, these are Tylenol, non-steroidal anti-inflammatory medications, gabapentin, and sometimes a muscle relaxant. Again, remember this is all tailored to you, and sometimes the narcotic medicines we give you have Tylenol in them, so you can't take Tylenol by itself. We will help you with that. The reason for some of these other medications is to treat your pain in a multimodal way. I often liken to patients that pain is like a dartboard and you don't win the game with one dart. It takes multiple. In addition to pain medications, I'm going to talk about a lot of other things that can help relieve your pain. In lower extremity surgery, it's extremely important to elevate. And you want to elevate the affected area above your heart. Your heart is the final drain point of your lymphatic system. That's what's helping drain swelling out of your limb, and that's a huge cause of pain if you become very swollen. Other things are just simple positioning. You can have your coach help you in bed, tilt just one way or another, a degree or two, and you'd be surprised how much that helps. Other things that help are icing. You want to do that in 20-minute sessions. If you leave it on too long, it has the reverse effect, so please set a timer. Other things are distractive therapy. What do I mean by that? Watch a good movie, call a good friend, talk to a family member who you haven't visited with in a while. The reason is that distracts your mind from your pain and helps you deal with it. When you are discharged from the surgical center or the hospital, the nurse will go over all your medications and the instructions again. It's important to know that they will tell you when you can take your next medications. Some of these medications are similar to medications that you receive either during surgery or in the recovery room. So they will instruct you on your home medications and when the first dose will be once you get home. When you get home, or even before the surgery, make a chart. In each row, put the medications that you're going to take for controlling your pain and swelling. And in the columns is where you will write down the times that you took these medicines. That will not only help you with the dosing, but if you run into any issues and you call our office, it will help us help you. If you're taking the pain medication as prescribed, the other medications as prescribed, and you've tried all the different methods I've told you to relieve your pain and it's still really bad, call our office. We'd be glad to help. It's also important to realize that it's unrealistic to feel that you should be pain-free. Surgery does hurt, but the good thing is it's temporary. At Orthopedic Associates of Wausau, we want you to have a great outcome. We're here to support you. And if you have any questions, please ask your surgeon. And if it's after surgery, give us a call.